Diabetes mellitus. Diabetes mellitus is an endocrinological disorder affecting multi-systems. It is a condition of hyperglycemic state, means there is an increased blood glucose level in our body. India is considered as the top country to have maximum number of cases of diabetes. Diabetes are majorly of two types, type 1 and type 2 diabetes mellitus. Type 1 diabetes mellitus I'll be talking about first. Type 1 diabetes is actually a T cell mediated autoimmune disorder where about more than 90% of the beta cells, islet cells, pancreatic islet cells is being destroyed. There might be various factors. It can be due to toxins, it can be due to virus, it can be due to um, any radiations which is directly affecting the beta cells. So a person who is already having a normal beta cells due to certain environmental triggering factors, as I mentioned now, they lead to insulitis. Insulitis is where we can see there will be increased raised inflammatory mediators, and later on they start to destroy completely and leading to more than 90% of the beta cells completely getting destroyed, where the insulin that is being produced is very much minimal in order to counteract the action of the hyperglycemia. So here clearly we have to depend on the insulin in order to counteract the hyperglycemic state. Um then coming to type 2 diabetes mellitus. Type 2 diabetes mellitus, the etiology exactly, the pathophysiology is not known, but uh, as per certain texts and researches, it is found that it is basically there is increased resistance, or we can say decreased sensitivity of the target organs to uh, the action of the insulin. So insulin is produced in adequate amount, the target organs are not able to recept the insulin action. There will be increased hepatic gluconeogenesis, glycogenolysis, lipolysis, proteolysis, which uh, increases the hyperglycemic state. The most common causes can be a family genetic predisposition, or there can be lifestyle related issues, means there is under exercises, or if there is obesity. So these are the most common causes or to lead type 2 diabetes mellitus. Coming to the complication, the most common complications that one can think of in diabetes are the microvascular or the macrovascular causes. Microvascular causes includes the nephropathy, retinopathy, neuropathy, whereas the macrovascular causes basically it affects the large vessels, atheromas, MI, in case of there might be cerebral hemorrhage, and also it increases the chances of make the person more prone for infection. The person will have candidiasis, then balanoposthitis, there can be oral ulcers, and even the ulcers do not heal so easily. The wound infections occur, and there might be chances of sepsis also. Um, Usually we tend to have Charcot's joint, and as a result of diabetic foot and amputation. So basically overall it is affecting the entire system. There might be renal failure, and in liver also there might be increased chances of infection there also. So overall it is affecting all the system. Coming to the management includes the investigation and the treatment part. So investigation, we have the glycosuria, that is urine test, from which we can predict uh, a person whether he's diabetic or not. But it is one key point is that glycosuria is not uh, so significant is not a significant indicator of diabetes in case of pregnancy. Coming to the other investigation, we have the blood glucose tests. So in that there are various tests like fasting blood glucose, postprandial, random. So we go for a glucose tolerance test. So here we give a person 2 to 3 days of carbohydrate rich meal, and prior to the test we ask the patient to go for fasting for a minimum period of 8 hours, and we draw the first blood, that is the fasting blood. Following that, we give the individual 75 grams of glucose, and then we draw blood 2 hours later, and then we assess for the blood glucose. The cutoff is that if the fasting blood glucose is more than 126 milligrams per deciliter, or if the postprandial blood glucose is more than 200 milligrams per deciliter, or if the HbA1c is more than 6.5, it is categorized as person being having diabetes. Then we have ketone bodies assessment, urine ketone bodies. Then we have protein in the urine, the albumin. So we have something called microalbuminuria, where the range is around 30 to 300 mg per liter. So that also helps to assess. Then we can go for the ophthalmoscopic examination, because they are very much prone for the diabetic retinopathy. And the symptoms usually person presents will be uh, hyperglycemia, of course. So the hyperglycemia usually presents as there might be giddiness, there might be weakness, and usually person will have very drowsy, thirsty feel, and they are having polyuria, polydipsia, and they might also tend to lose weight because of increased lipolysis. Then also it actually varies if it is type 1 diabetes mellitus or if it is type 2 diabetes mellitus. In type 1 usually the weight remains normal or it reduces, but in type 2 it usually the patient starts gaining more weight um, because of polyphagia. A person becomes more prone for infections, and he will have peripheral he might have neuritic related issues, and also he becomes more prone for fractures. The immunity might decrease drastically. There might be unexplained weight loss. So these are some of the common features that occur in diabetes. Coming to the treatment part, as I mentioned that type 1 diabetes mellitus, it is insulin dependent, as the beta cells are almost destroyed. So we go for the insulin. Insulin is actually a polypeptide which contains A and B connected by disulfide bonds. They are of uh, there can be various types of insulin depending on the duration of action we need. So we have ultra short acting, intermediate, and long acting insulin. The ultra short acting includes the insulin aspart aggrosine. The mode of the onset of action occurs within 15 minutes and it lasts for 2 to 4 hours of duration. Coming to the short acting, we have the regular insulin, which the onset of action occurs within 1 hour and it lasts for around 6 to 8 hours of duration. Then coming to the intermediate insulin, which is the isophane insulin, uh, the NPH. Uh, the duration of action, the onset of action is within 3 to 4 hours and it lasts for around 12 hours. Uh, then we have the long acting insulin, which is detamir and uh, insulin detamate and glargine, which the duration of action lasts for about 10 to 24 hours. The most common side effect is definitely hypoglycemia, and the other mode of treatment is uh, the oral hypoglycemics. There are different types. They can be sulfonylureas, bioguanides, or DPP antagonists. Uh, then we have GLP-1 analogs. Um, these are the in which most commonly used is glimepiride, and we have metformin. Apart from that, it's very important for making the individual go for a nutritional therapy and exercises, because that way we will be able to control diabetes to an extent apart from the medical management. The complications include the diabetic ketoacidosis and hyperosmolar hyperglycemic state, uh, complications for type 1 diabetes mellitus and type 2 diabetes mellitus respectively.